Hello and welcome to LociMania IBD, inflammatory bowel diseases. Here I've combined Crohn's disease and ulcerative colitis in one video because they're very similar in many kind of ways, but also have some differences, and I'll save you some time by showing you everything you need to know about both. When it comes to where the location of the disease is, in Crohn's disease, which I will call CD from now on, uh, goes from the oral cavity all the way down to the rectum. Ulcerative colitis, I'll call it UC from now on. It goes from the colon all the way to the rectum. Crohn's disease works from a transmural way, so it goes through the bowel walls and can cause fistulas and perforate the bowel, while the ulcerative colitis works only in the mucosal and submucosal tissues. CD, you have normal diarrhea. In UC, you have bloody diarrhea. CD, you have a pain on the right lower abdomen. In UC, you have a pain on the left lower abdomen. Moving on to symptoms and diagnosis, you already discussed the pain and diarrhea as well as bleeding. This is some of the symptoms you can see. They're both chronic. You can see weight loss. And when it comes to diagnosis, you should do a blood test to check for any anemia, any infections, viruses. Even in the stool, you should check the blood in there if there is any bleeding. Endoscopies, you should do a colonoscopy or upper GI endoscopy to check for any granulomas, which will help you point you to the direction of the Crohn's disease. Then you can do X-ray or CT scan. X-ray to check for any perforated colon, and CT scan for a better picture. Moving on to the treatment. Mesalamine, which is a aminosalicylate, will help reducing the symptoms of the Crohn's disease or ulcerative colitis. That's one name for it. Also, sulfasalazine is another name. Budesonide is a corticosteroid, which will also help against Crohn's disease and severe ulcerative colitis. You give painkillers as well to relieve the pain. Vitamins, very important, because you have diarrhea and a lot of electrolytes are coming out and fluid is lost. And of course, antidiarrheal medications as well to help against the diarrhea. So as you can see on the left and right side, I've written that CD, you have no surgery, because if you do a surgery on the Crohn's disease, it will recur at the site of the surgery. And on the ulcerative colitis, the surgery will be effective. It will be a good outcome from that. Also, I've written that you will have to give the Crohn's disease a drug called infliximab, which helps the patient to fight against the fistulas, which happens in Crohn's disease because of the CD is transmural and goes through the walls and can perforate. When it comes to complications, you will see that colon cancer can happen in both diseases. It's just because it just matters about the time, how long. So you see in the middle I've written 8 to 10 years. So 8 to 10 years is enough for one of these to develop into a colon cancer, especially the UC, which transforms to a toxic megacolon and makes a huge colon carcinoma. In CD, you also have malabsorption, and fistulas can occur as we've discussed. And in both, you will see inflammation going to skin, joints, and the eyes. And going on to our last slide, which is a mnemonic for you guys to remember everything we just said, or most importantly. It's called GALS, and you have the lady in the right upper corner. I call her Chrony D because she has everything mentioned on this paper. So G in GALS and G in granulomas, that's connected. Granulomas occurs in Crohn's disease and not in ulcerative colitis. A for all layers, and that's because Crohn's disease happens in transmural way, so through the bowel walls, perforates, makes fistulas, while in ulcerative colitis it only goes mucosal and submucosal. L for levels. Crohn ED got levels to this, and that's because Crohn's disease happens all the way from the oral cavity all the way down to the rectum, while ulcerative colitis only from the colon to the rectum. And lastly, the S for skip lesions. And what do I mean by that? Crohn's disease, it has lesions, could have lesions which have a pause. So part of the tissue is damaged, then some healthy tissues, and again damaged tissues. Ulcerative colitis happens continuously throughout the lesion. It doesn't have any spots, it's just a continuous lesion. And that was everything for IBD. Hope you enjoyed it, and I'll see you next time.